Good morning, everyone. Thank you for joining us for today's webinar, Pennsylvania Health and Wellness Nursing Facility Claims Testing. PA Health and Wellness also presented a webinar on contracting yesterday, if any of you attended that. If you were unable to join that webinar, the recording will be available on the PHCA website under past webinars later today. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website before the end of the week. Today's webinar is informational and not for credit. Feedback is important to us, so you'll be receiving a survey following the webinar. Please complete the survey, and if you're participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, feel free to submit questions using your questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Now for today's webinar. This webinar is being presented by Tracy Celebrado, Director, Provider Network LTSS with PA Health and Wellness. Tracy will provide an overview of claims testing process and ramp manager. Your learning objectives for today's webinar include understanding the claims testing submission process, an overview of testing modifications and next steps, and lastly, preparing for go-live business and claims submissions. I'll now turn the webinar over to Tracy.
Hello, good morning, everyone. Thank you for having me today as a presenter for you. As we quickly approach Go Live, we thought it would be great if we could have this type of webinar that is informational and will help guide you through the claims process and claims testing process. I also have on the line with me Rita. Rita is our Senior Business System Analyst over the EDI section, and she is our go-to guru here at Pennsylvania Health and Wellness for the claims testing. And so she will also be available on this call with me for any questions that we have after the presentation. So a little bit about my background. I transitioned here to Pennsylvania Health and Wellness back in September of 2017 from our Centene Florida plan, Sunshine Health. I have worked with the LTSS Provider Network for the past 6 of my 7 years here at Centene, so I'm very familiar with the nursing home communities and management groups and the structures and how to partner our relationship. Prior to even getting into managed care, I worked on the provider side, so I sat in an office like all of you, working in the billing department and understanding the relationship between the biller and the health plan, as well as understanding the updates that you all have to provide to your business owners. I wanted to make this informative. I'm sorry, we have an echo on the line. Thank you. So today's webinar will be that informative, help you to understand what is available as far as resources, help you to understand how to partner with us on the billing and claims process. And so Centene is a very large MCO, government-sponsored healthcare programs and implementations in 28 states, soon becoming 29. Our product line expands from Medicaid, Medicare, Snip. We have commercial. We also have correctional insurance coverage, employer insurance coverage. We're in 2 international markets, the largest LTSS provider in the country, with 11.5 million members, and that includes 2.8 million TRICARE eligibles. We are based in St. Louis, Missouri, with more than 30,000 employees. And in 2015, we were number 4 as Fortune's fastest growing companies. We work in LTSS markets in states such as Florida and Kansas. So our understanding of, the community and the population we serve comes from other health plans that have already worked on this product line. Our claims reimbursement presentation today will cover for you how I can submit claims. And so it's very important to understand when you are submitting your claims that you can either submit them through an EDI partner. So if you have a company that you work with, such as Availity, you can continue to submit your claims in the same process. We also have a secured provider portal, which will allow you to send all of your claims with batch process and claim entry at no cost to you, but you do have to be a contracted provider and register for the portal to access that feature. And then as of July 2018, we made an arrangement with our HHA exchange partners to open up the ability to submit claims electronically through their portal. But again, you would have to be contracted and also participating and registered with HHA Exchange. So there's several ways that you could submit your claim, all at no cost. And the use of electronic submission increases your acceptance and accuracy rates, and it does decrease the time of receiving payment by check. It's important to know that when you are submitting your claim, that data is important. Accurate data is most important. When your claims come through our system is going to look at what you've put on the claim and what we have in the system. And as a safeguard measure, they are going to match up data for data. If your claim comes through and a member ID is missing 2 of the numbers, your claim will reject. If you send a billing address that doesn't match our system, it will push it back. So it's important that your claim submissions 100% align with all of the contracting data that has been submitted to us on behalf of your facility. So if you are the person who handles the contracting and the billing, then just, make sure that the data matches. If there's another person within your organization that does the contracting, before you submit your first claim, just make sure that you both reconcile, your data, because what comes through on the contract is what we're going to have on the system. Another important piece of information is our claims require that you have your Medicaid Promise ID on that claim form. So the 13-digit, including service location, must be on your claims. If they're not, it's hard for us to find you as a provider in our system, and most likely it will reject with a code that says provider is not contracted because we can't find you in the system. To avoid delays in your claims payment, all claims coming in must have all appropriate identifiers identifying and validating billing and rendering providers, service locations that are registered with the state's Promise system. So all billing and rendering provider info is subject to upfront editing, against the promised systems. We have to make sure, again, that any claims that come in with missing data may be sent back to the provider and are not considered clean. So the billing guide does include step-by-step instruction by each box on what data is required to complete for a claim. If you choose to submit your claims on paper, they must meet the criteria for OCR processing. So we have to have the original red and white form, HCFA, UB. We don't accept photocopies. We have to have forms that have blue or black ink only. We cannot accept anything that's red or any other pen color or ink color. Our claims have to have 9-point font or larger, and we cannot have anything stamped or handwritten onto the claim. So if you are handwriting your claim, we cannot accept it. And we also include for you on this presentation, on our website, and in our billing guide, and in our provider manual, the claims address for all claim submissions. We cannot accept claims here at the health plan. We can't accept it by email. We can't accept it in mail. All paper claims have to go to our Farmington claims office in Missouri. If you are looking for a direct claim submission, you can enroll in the portal, Pennsylvania Health and Wellness portal, and we have a claims wizard which allows for multiple direct claim submissions. You can do a batch upload. You can do a single claims entry, and the feature also allows you to bill recurring monthly services. So in your initial registration and setup of the portal access, you will have to enter all of your participants into the portal for the initial billing, and then every month after that, they would be in there, and you just submit for the current month that you're billing for. It's a quick and accurate way to bill claims. So quick and accurate means once you've entered it into the system and it's properly working, you can know going forward you won't have any other issues. It's a one-time load and quick and easy interface to bill services for multiple participants, same services, dates of service, and the electronic transaction decreases your process time and increases payment accuracy and timely payment. We did just get an approval on our billing handbook from OLTL. So much of the billing guidelines that you see here will also be in the handbook. So for us to have a good partnership and for you to feel comfortable with the claims process, it's very important that you and any of your staff involved know what the billing guidelines are, because as a partner to, 3 MCOs, I don't know how aligned our billing processes are, but if there's any differences, it can get confusing. So it's important to know the billing guidelines. It's important to have the billing handbook available for reference. If you are unsure of how to submit your claim or if your claim has all the right data, it's better for you to reach out to us directly, get that clarity, and then submit the claim. Because what happens is once you submit a claim and it's rejected, it then becomes a repetitive cycle to try to get that claim paid and submit a clean claim form. So hesitate in the beginning if you're not 100% sure. Don't hold up your billing, but make sure that you fully understand that when I submit this claim, it's going to go through. Because even through the testing, we may show you as a pass, but each and every time you work a claim, it has to be 100% accurate and clean. To know claims cannot be billed in advance of the date of service. We typically see a lot of the claims come in like between the 1st and the 15th of the month, and you are billing for the month previously served. So just make sure that as you are billing month to month for your residents, that you've also looked at their enrollment. We do see rejects coming through for member not valid at date of service, which means the enrollment start date and end date don't align with the month that the claims are being billed. So knowing that in this program, participants can change their coverage, I strongly recommend that before you submit your claims for each month, that you look at the enrollment and make sure that A, they were active with PHW if we're getting the claim, and B, if they're not active with PHW, that you know who they are enrolled with, because you'll get a lot of recycling of those rejects if you don't have them aligned. We also work with revenue codes. So these codes here, 100, 185, 183, they will be on your contract. So your contract does include a grid that gives the rev code and the service description, and we also make sure that the rates are included in the contract. So if you bill for your bed hold days, the rate has to be reflective on the claim. It has to be reflective to what was put on the contract. So again, make sure that if you're not the contracting person, that you are aware of the rate that was put in your contract, because if you submit a rate that is higher than what was on your contract and put in the system, we will then only send you the payment for what was in the contract. So it's important to be 100% sure of what your rates are before you start billing. We bill on the institutional room and board, the bed holds, and our professional claims. So if you are working with a DME provider for exceptional DME and you are submitting a claim, those do have to come over on the 1500, and any kind of vent supply, which is also included in the contract, and any respite care, which is also an inclusion in the contract. So your room and board per diem should only be billed on the UB, and any of your DME or respite care or supply services or items should be on the HCFA. If you submit a DME on your institutional claim, I don't know that it would get paid. So that may be another roadblock to getting a claim paid. So just make sure your team is aware that these do have to be submitted separately and on the right form. Otherwise, it could kick back. Also, in your contracts, we are including the dish and vent supplemental payments. Our methodology for dish and vent is based on a look-back period that we agreed to with the state and with the associations, and also is a calculation. Again, this rate needs to be in your contract, and it's important that you coordinate, with that contracting person what the rate is. You want to make sure that these rates, if you're eligible for the payment, that you are billing for them and billing the appropriate rate, and not submitting the claims without them. So just coordinate that internally. The Appendix 4 payments, we are administering them, and we are administering them in accordance with the contract requirements for all nursing facilities. This check is actually not driven from the claims system. This is an administrative payment. So for us, administrative payments come from finance. So when you see these Appendix 4 payments come in, there's always a letter attached to the check from us that would say, hey, here's what we're paying and why. As these come in, if you're unsure, last year or earlier this year, we worked with the associations in that communication. So when we get to that time, there'll be more details. Another common denial or rejection that we found was claims were coming in with the incorrect bill type. So it's very important that you use these types below. Submitting correct bill types allows the appropriate edits to apply, and our system does kick out if the bill type is incorrect. This information is also available in our provider billing manual, and it should be in locator field 4. Considerations as you submit your claims. One of them is the share of costs or resident cost of care. Claims should be submitted with all value codes as they were through fee-for-service. And our systems are configured to mirror the current cost of care between facilities and OLTL. A lot of questions came up in the Southwest on share of costs, and you should continue to follow the process as it is currently with the way that you present share of costs on your claim form and any allowable charges that you're able to include in addition to that. Third-party liability, and so for LTSS, Medicaid is always the payer of last resort. And so we want to make sure that we communicate clearly that all primary payment sources have to be exhausted prior to the reimbursement of service that could be covered by other payers. So what that means is most likely your residents are duals, and you would have to process through the primary insurance before submitting a claim to us. We do require a CoB attachment with the submission. And so I cover here our Medicare and third-party liability claim submission requirements. CoB comes up quite frequently, so we also include some tips on when you submit. So if the participant is dual here, we automatically cross over. We were planning to have a automatic crossover, and I don't know where that stands. I know it's been in the works, and once I have information on that, I can share. But claims and primary EOPs for Part A and B will not need to be separately submitted for reimbursement. Nursing facilities will bill Medicare for the applicable coverage. Medicare participants and DSNP, same process. For participants enrolled in another MCO DSNP, covered services and days and claims for CHC applicable coinsurance amounts must be billed with the DSNP's MCO explanation of payment. So if they come, the claim comes in and their Medicare is another MCO, we do require the EOP with that. Claims are only Medicare non-covered days and do not require a primary EOP. If the participant has coverage other than Medicare, primary payer explanation of payment is required for claims processing. Most important is timely filing. It is a Centene policy that we have a timely filing of 180 days for first-time claims, and also 365 for corrected claims from date of payment and denial. Understanding that in the first few months, there is a learning curve, so we're getting to know how to work with each other. There have been exceptions made due to any system issue that PHW had. So if you submit a claim and it rejects, and by chance it happens to be a system issue, we would honor that you did not have that opportunity for a clean first claim. But if you're submitting with an incorrect member ID, or member was not valid at the date of service, those would not be considered exceptions. So when these issues come up, it's best if you let us know, hey, I'm here in June of 2019, and I have a claim from January that I could not get fixed. Hopefully we're not at that point, and we are working through some of the lessons learned from the Southwest, but it does happen. And so to be prepared for it, just make sure that you communicate with us as soon as you start to see a trend in any claims issues. Our state contract and guidelines require us to process 90% of clean claims. That's clean, meaning free of any error, within 30 days, 100% within 45 days, and then all claims 100% within 90 days. Our EDI partners are here up on the screen, and so we do work with a lot of vendors. Availity seems to be a common EDI selection. Claim submissions, when you go through the portal, PHW portal and HHA Exchange are free. When you use an EDI partner, you're sending them a batch file. My only recommendation is to make sure that as you're uploading the batch file, they're not sending us a paper claim. So just make sure in your EDI partner selection, if you don't have one, that you are insured. If I send you my 837 file electronically, that it will continue to the MCO electronically and not converted to a paper claim, because that could also delay your payment. It could also create a misunderstanding if the claim, you've sent it electronically and your EDI partner sends it on paper and we haven't received it. So it's very important to understand how that happens. If you want to submit through our PHW portal, it goes directly into our claim system. If you work with HHA Exchange, it's 100% electronic, and they send us the claim. We are talking with OLTL on a weekly basis, and they are very interested to understand our progress in the Southeast, not only for the contracting piece, but also for the claims testing. I think the biggest lesson learned from the Southwest was we probably could have started this a little bit earlier. Late in the year, we were claims testing, and then when January came around, it was like the mad scramble to get claims to process and make sure providers were comfortable. And so when I heard in May, OLTL mention their interest for us to start claims testing, I took that as a sign and implemented the claims testing process in June with my team. We have been actively outreaching in June and July and August to get the process started. We've gotten some providers who have declined, which is okay. You have the opportunity to test or not. Some were Southwest facilities who felt comfortable. Hey, we're submitting in the Southwest and everything is good to go. But we are also, getting providers who are testing and they are passing, meaning they've submitted exactly how the testing asked them to, and they're getting through. But we also have some who are rejecting. And so Rita is our go-to person. And so I'm going to pull up for you the ramp manager document. that we sent out back in June to our point of contact to say, hey guys, we're interested to start the testing. Testing does not require you to be contracted or fully enrolled in our system. Testing is our way to make sure that we're not waiting until January 1st to find out if there are any adjustments that we need to make or there are any adjustments that the provider needs to make. So the testing is a very clean process. You get your results back to you in that same transaction. If you pass, you're good to go. We'll wait for your claims in January. If you fail, we've got the support to help you walk through how to get to a pass notice. And so this overview that we send to you also includes a link to register. So to register for testing, you have to go and click on this link and register for the account and follow the registration steps that we have provided you in this document. After you log in, you'll have to confirm and accept the trading partner agreement. And then we walk you through how to create the claims testing. It's step by step, and provider feedback has been that it's been a fairly easy process. You will get back, a file that shares, whether or not you have passed or failed. As soon as you get to the point where you've received this notice, Mary Williams is my staff here who will be your point of contact for the claims. And I just noticed that when I gave her name, I had a typo in her email address, so I'll have to correct that and get it back to you. But Mary is reaching out to all of you, your facilities, and looking to get you registered for the testing. And then she gives you her information and works with you, and you send her the test file notice once it's complete. And then she helps you get to Rita, or she says, thank you, we'll document this. OLTL has asked us for a weekly update starting this Friday on all facility testing status. So I have to let them know facility by facility who is tested, who is not tested, if they did test, what was their status, and if they have not passed the test, are we working with them to get them to a pass, notice. And so we do document and keep all of our testing outreach and our testing results on file for that purpose, because OLTL has asked that we keep that. There are more instructions here on the submission that you can go through and take a look at. I can share this with you all through the association. And then if you have any questions, I will include in that email Mary's and my contact information so you can follow up with us. And so I'll turn it over now for any questions.
Thank you, Tracy. That was really great information that you shared with us today. At this time, we'll open up the question and answer portion. We already have one question, which I'll read here in a moment. Just type in your questions and we'll read them and have Tracy and Rita answer the question. So let me give you the first one. It's kind of lengthy, so hang in there. What is the correct way to report Medicare coinsurance on a Snip claim? That's the first question. That's the first part of the question. And then maybe I'll just read the rest of it and we can go back to it. PA Medicaid requires a value code of 100 and 0 units for that service line. Do you have the same requirements? We partner with MDON as our clearinghouse, and they reject all claims which have 0 units on the service line with rev code 100. We've tried reaching out several times to provider services for help with this issue, and no one has been able to help us. Guide us to the correct resource. The billing guides we've been referred to do not have this information.
That was lengthy. A lot of good questions. So I'd like to start from the bottom up and first address the billing guide. If this is in reference to the Pennsylvania Health and Wellness Billing Guide, we do have an updated version on our website that just went up the beginning of this week. So I'd recommend that whomever has submitted that question go back and take a look. And if you still see that we're not giving you enough clear information, I am more than happy to take any and all feedback to our claims team and our provider team who drafted the handbook and present where there might be a little bit confusion. With regards to provider services, we do have an 844-626-6813 provider services team that is available to assist with any and all related issues to the nursing homes. If questions are not getting answered at that level, it would be good to follow up with me by email, and what I would need is an incident number. So our call center tracks all provider communications through incident numbers. So if you give me the incident number, I can then go back to the exact conversation and who you spoke with and figure out, what is the issue and what have we done to resolve. What tends to create sometimes a slower than usual response or not sufficient update is if I don't have the information needed to move it forward. So in short, if you have an issue, you've worked through the process, you've called the 844 number, you're not getting what you need, you then escalate it to Provider Network with that incident number, and then we can work towards getting you immediate resolution. MDON, as your EDI partner, if there are certain restrictions within your EDI transmission, and when I mean some issues, it doesn't align with the health plan's requirement for submission, we can connect you with our EDI corporate team, and they can work with you to get some understanding and then also work towards resolution. I don't know MDON well enough to know why they would not allow the 0 units, but definitely we can help you get through it. But we need to know specifics as to what the issue was.
Hi, Tracy. This is Rita.
Yep.
We do work with MDON. Every week we have a follow-up meeting with them. So if you were having some issues with them, please reach out and we can take the file through Ramp Manager and we can discuss that directly with MDON after you have followed the protocol that Tracy had talked about.
Awesome. Thank you, ladies, for answering that. Let me see here. Let's see if we have another. It looks like we may have a follow-up. Let's see here. The question, okay, so looks like more of a comment. In New Jersey, once patient is no longer Medicare eligible, only one denial EOB is required yearly. But if Medicare Advantage, then each billing must have denial EOB from Medicare Advantage plan attached to billing. So
Okay.
comment on that, on how things work in New Jersey.
Yeah, not familiar with New Jersey, but here in our health plan, if the participant has primary coverage other than Medicare, then we do require the EOB. So Medicare Advantage is really a Medicare-based product, but it is not traditional Medicare. So we would consider it another MCO policy, and you would have to submit the EOP with that, and the denial if they don't pay it.
Okay, awesome. Thank you, Tracy. We have another question. It says, thanks for answering my previous lengthy question, which is not a problem. Lengthy questions don't upset us. Please bring them. We want to have all your questions answered, so just type them in there. Lengthy or short, we'll take them. So here it is. One, as a skilled nursing facility, we report the resident's income on the claim. Often after we bill, we need to adjust the income reported. Is there a way to make the adjustment on the PA Health and Wellness portal? When we look at the claim, we do not see the value codes that we billed with.
That is a really good question, and very much an activity in the Southwest that we're seeing. So when you submit your original claim, as long as the claim processes and you've received payment, you should not go back and make any adjustments to that claim. If you've submitted a claim and you realize that there was an error, other than share of costs, you would have to submit a corrected claim. In the patient share of costs, in my experience, so coming from another environment, share of costs will truly never align month for month. That's why, as a health plan, we communicate for you to bill what you have as current month. When it gets to the system, our files will reconcile from what we've received from the state, okay? And if there are any discrepancies in pricing, our system automatically calculates what the difference is. Whether we've underpaid or overpaid, the system automatically triggers to let us know, hey, share of costs, that you need to look at this. So I wouldn't make any adjustments to share of costs. I would just allow the process to work, and then we do have some lag time in the reconciliation. So you may not see that we've reconciled for 2 to 3 months until after the claim is processed. So we run on cycles, but we will make sure that we've adjusted.
Great. Thank you, Tracy. Any other questions? I don't have any questions in the question pane right now, but keep bringing them. If you have any questions, please type them in. We still have a couple minutes left here in the hour, so we've got time. We'd love to have your questions. And we do have a new question. What if we want to adjust the amount deducted for a health insurance premium? The state does not have that information for you to reconcile with.
Okay, Wendy, can you translate that a little bit for me? So there are deductions that the nursing home can make on the claim form. That piece I understand. So they're deducting for the premium, which is an allowed expense to deduct from the claim form. So what type of adjustment would be made? I think that's the part that I didn't fully understand.
Yeah, it just says, what if we want to adjust the amount deducted for a health insurance premium?
Yeah, I think it is an allowed deduction on the claim, and I don't know the adjustments that would need to be made. So, Wendy, maybe if you could send that to me in an email, And let me
You bet.
circulate that through here and see what I can come up with.
Surely, will do. Another question we have is, could you clarify the CoB requirements? Would we only attach the EOB when Medicare or other payer could be billed? If they have exhausted benefits or cut from insurance, would it still need a CoB?
So CoB is not specific to pay or not pay. If you get a denial, that would also be an attachment to include on the claim form. And so if primary pays, you're notifying us in your submission that they paid and collecting a payment from us. If the primary is denied, you're following the same process. If there's zero payment, it's more of a notification to close out the process. So we have to always follow whatever the coordination of benefit is for each and every participant. And as Medicaid not being the primary or the first payer of resort, we have to know that there was a submission to primary if the participant has primary coverage. Whether they paid or denied, we still have to be notified.
Okay. Thank you. We have a clarification to the earlier question. Health insurance premium amounts. If we receive new information after billing that indicated we deducted the wrong health insurance premium, how do we adjust that claim?
That would be through a corrected claim, and it would have to represent all payments. So if you submit a corrected claim, okay, there has to be adjustments in that claim that say, we are not attempting to collect the entire amount. We just want you to know that in our posting of the premium, we miscalculated and we want to have you relook at the claim. So when you submit a corrected claim, you have to be very careful that you are not presenting it as an original claim. And many times we see that come through. So if you've submitted an original claim and now you're going to correct it, if you submit a second original, meaning you haven't marked it as corrected, the system will deny it and say it's a duplicate. And those are safeguard measures so that we don't reprocess the same claim. So corrected has to be on the claim form, and the adjustments of any payment or EOB that's already been considered has to be included in that reprocessing of the claim.
Okay. Is a physical EOB attached or just a claim indicator code on the claim? Looks like a cutoff.
Yeah, it sounds like crossover claims. So I have to take that one back to see how we are managing. There are ways to have a automatic crossover from primary to secondary. That's the part I need to get follow up on here internally. But if you are submitting and there's no crossover capability, you do have to provide the EOB, the physical document. You have to submit it with the claim.
All right. Any other questions from our attendees? Please type them in. We're taking questions until 11, so we still have about 6 more minutes. If anybody has questions, we'd love to get your questions answered today. And know that
while we're waiting, can I just share one more template with this group?
You bet.
So in talking about, claim submissions and having a correction made or assistance, we do have a claims template that we have rolled out here. And when we work with our nursing homes, we are working to have a claims project template updated. It's very important in the relationship part. If you're having issues, it's very hard for us to just go and look at a general overview of provider claims issues because we manage a lot of claims and a lot of providers. each and every day. And so what we've done to kind of help, transition the information from provider to our claims team is we've implemented this template that will help, and it's a line item by participant resident name, and we're looking for specific information so that we can be more timely with your update. And so I will share this with all of our providers so that they know when they're working as an escalated issue or issue on unresolved, we have a template that will help get you the updates much quicker.
Excellent. All right. Question here: where can we find this Snip claims project template, and where should we submit this to?
Okay. So I'll make it available to all of our providers. So I can send you, Wendy, a copy of this to share with your nursing home members. And when you get this from my team, which is Provider Network, which is your second level, follow-up to claims issues, my team should provide this with you to gather the information. And also it would be good for you to include any incident numbers that you have for reporting these issues on this form so that we can make sure we have good follow-up with that team as well. So you'll send them back to the rep who sent it to you.
Great. Here's another question. Change Healthcare allow attachment of denial EOB to claim with denial EOB to be accepted EDI via claim to PWC. Sounds a little broken up there. Not sure if you catch that one or not. You want me to read that one again, Tracy?
Yeah, could you read that? I'm not sure what PWC stands for.
Yeah, Change Healthcare allow attachment of denial EOB to claim will denial EOB be accepted EDI via
electronically
to PWC?
Hey, Rita, could you take that one? Do we take attachments?
Yeah. No, we do not through Change Healthcare. You can do that through our web portal, but we do not do it with the clearinghouses as of yet. That is on the cusp of the beginning of next year to start working to get that implemented with all the with all the clearinghouses.
All right. Thanks, ladies. All right. Any more questions? We'll take one more question if anybody pops in here with a question while we're waiting. I just want to remind everyone that we will be having, PHCA will be having, along with other provider associations, a training day on Thursday, October 4th at the Valley Forge Casino Resort. All three of the MCO plans will be there. It is free of charge, and we're asking that facilities bring just three people per facility, since it is space is going to be limited. We expect a big crowd, and there's plenty of space, but we want to limit it to 3 per facility. So look for that information coming your way very soon, hopefully this week or early next week. Again, that's Thursday, October 4th at the Valley Forge Casino Resort. And also the plans will be at our annual convention. If you haven't registered for it, they will be there the morning of Tuesday, November 13th, also at that same location, the Valley Forge Casino Resort. So check the PHCA website if you haven't already registered for the annual convention. And seeing no more questions, I'm going to ask that when you receive the survey, please fill it out. The feedback is important to us here at PHCA and our speakers. The recording will be made available later today on the PHCA website. And I just want to thank Tracy and Rita for their time in presenting on this topic. Thanks, everybody. Have a great day.